Now for next off, we're trying to look at what's known as a hip arthroscopy. Alright, hip arthroscopy. So for this hip arthroscopy, you could say it's just a minimal invasive surgery. So they use it to diagnose. Okay, they can also use it to treat conditions. So conditions inside the hip joint. Okay, so it's becoming increasingly popular due to its precision, reduced recovery time, and there's lower risks of complications coming up if you do this if you do this hip arthroscopy. All right, so what happens during hip arthroscopy? The surgeon makes small incisions near the hip. Can you see that this one is just a hole that was put? Okay, so a device called the arthroscope is what is now inserted through the hole. Okay, this allows the surgeon to see inside the hip and use specialized tools to treat the problem. So it's commonly performed as an outpatient procedure, meaning you can go home the same day. Okay, same day they perform this. So conditions treated, last, which type of conditions could you actually use to treat these issues? So things like what? Femoroacetabular impingement, labral teres, snapping hip syndrome, hip dysplasias, loose bodies, septic arthritis. Alright, so all of them you can actually look at the descriptions. Okay, a brief description about the condition. So benefits: there's smaller incisions, reduced pain and scarring, faster recovery time, there's lower risk of complications. Okay, so that's just what the hip arthroscopy simply means. Alright, so let's go on. As we later on we'll talk about the various conditions, we'll still be mentioning it and you guys will get to understand it better.